I'm Dr. Edward Ddumba, a senior physician from Uganda. I came over to India for assistance after having been diagnosed with obstructive jaundice in Uganda.
My name is Dr. Rakesh Rai. I am hepatobiliary and pancreatic surgeon, as well as I am a head of transplantation. I do liver, kidney and pancreas transplantation. Recently, we have operated on Mr. Ddumba. He is a very senior consultant neurologist based in Uganda, Kampala. He was earlier director of one of the most famous government hospital there, and now he is director of St. Francis Hospital in Kampala.
Whereby I was supposed to undergo a surgical procedure to overcome the obstruction. So initially I was referred to Nairobi Hospital, where a stent was put in the hepatic duct, but that was the sort of palliative arrangement.
Investigated in Kampala, and then he was suggested to go to another country because this was thought to be a complicated problem. They suspected that it may be a cholangiocarcinoma. So further specialized treatment, he flew to Nairobi. He underwent a metal stent placement in his bile duct.
They were able to contact Professor Rakesh Rai, and he received us, and they ordered some investigations, and they confirmed that I had a tumor from the biliary tree called the cholangiocarcinoma, the early stages. So he advised surgery, for which I underwent, and this is the 10th post-operative day.
Dr. Ddumba himself did a lot of research and found out that probably it will be better done in India. Through few of his colleagues, he knew me, and they also suggested him to come to India. So he came to India and he consulted me in Fortis Hospital. I evaluated his previous scan. We also did a scan, and we found out that his blockage in the bile duct is a cancer, which we call as cholangiocarcinoma, and unfortunately this is a very, very bad and aggressive cancer. And the only curative option for this kind of cancer is to do a surgery where you have to excise the extrahepatic bile duct and you have to reconstruct the biliary drainage. Along with that, all the lymph node along that area has to be excised. Part of the bile duct sometimes needs to be resected as well. We assess his fitness, although he is close to 60, but he is a very fit gentleman. So we decided to go ahead with this radical surgery, which was carried out at Fortis Hiranandani Hospital in Vasi. Surgery went very well. We did some frozen section, which is the examination of the tissue while we are operating, and we could get a clear margin of all around the excision. Post-operatively, Dr. Ddumba made a straightforward recovery. He was discharged on day 9 from the hospital, and on day 10th he is ready to fly back to Uganda.
I'm doing very, very well. I've regained my strength, and he's given me the treatment plan and also continued support in terms of consultation as we go through to the end, the conclusion of the treatment.
Now, this cholangiocarcinoma, which is the cancer of the bile duct, can be within the liver when we call it the intrahepatic cholangiocarcinoma, or it can involve the extrahepatic biliary tree when it's called extrahepatic cholangiocarcinoma. These cancers have overall a poor prognosis. Almost 60 to 70% people who develop this cancer will come at an advanced stage and may not be suitable for any kind of resection. And even if the resection is involved, it's a very, very complex surgery, because there are a lot of other important structures around the bile duct like hepatic artery and portal vein, which are the blood supply to the liver. So you have to be very careful to safeguard them. and this surgery involves also taking out all the surrounding areas lymph nodes, which again we send for examination, but the surgery is the only possible curative option which can prolong the survival in this bad cancer. Fortunately, in case of Dr. Ddumba, everything has gone very well, and I wish him a good luck, and I hope he is one among the people who have got a long time survival with this cancer.